All right, guys, let's have a look here. Where were we? Last time we talked about liver yin deficiency and where that heat goes, right? So we were saying, look, there's something called organ symptoms, which is the normal kind of TCM herbal training. And that's kind of what you're thinking about there. Usually, running hot, your eyes are dry and red or whatever the case may be, indicating liver yin deficiency, standard set of symptoms, let's say. But then, what the theory says is that liver heat kicks out to the gallbladder, and then that gallbladder heat kicks out to the gallbladder channel. Now, that only happens when the gallbladder is healthy. So if it's been doing that for a long time, where you got a lot of liver heat and it's getting into the gallbladder and the gallbladder is kicking it out to the channel, so you're getting a bunch of channel symptoms like we talked about last time. But at some point, the channel kind of like overflows or overfills, and it starts to back up into the gallbladder organ itself. You see this, it could be like an alcoholic kind of situation, or something, enduring stress or something of this nature, and you start getting gallstone issues or gallbladder attacks, quote unquote, from oily food and these kinds of things. These would be an indicator of now an organ problem sort of retroceding from the channel back to the organ, and then as it builds, it goes back into the liver organ, which would be kind of the worst. You start getting cirrhosis of the liver or some kind of liver disorder, so whatever the case may be. So this is the general run of it, right? This is how we think about the difference between what constitutes an organ sort of quote unquote symptom versus a channel symptom. So this is how the general theory runs, because you have to remember, guys, that our education in school, it's an herbal education. You're learning acupuncture, but you're learning acupuncture through an herbal lens. It's essentially herbified acupuncture. Each point becomes like an herb, where it has a sort of specific fixed set of functions that it does, and there's not much room to stray from that. You might get into some of the Shanghanlun family traditions or something like that, Jingfang or something like Arnaud style, so then they might have some different ideas about what the herbs do, but even these don't stray that far. They all kind of intermingle and explain each other and mix together. So when you start applying those same relatively fixed definitions of what an herb does, people aren't really arguing about what Bai Shao does all that much. Not a lot. When you start applying those relatively fixed notions to acupuncture, then you start to run into a few problems, because then you're losing something there. I mean, it makes it very easy to teach, it makes it easy to administer, but it doesn't give you a lot of room to grow in it. Because you don't necessarily walk out of school understanding exactly why spleen 5 is different from spleen 9 all the time. And how that informs the difference. What about liver 8 or kidney 10, as we've talked about, right? These kinds of applications, this is where an acupuncture system comes into play. And then each acupuncture system will define for itself what constitutes acupuncture. And this is where acupuncture is much more malleable, much more plastic in that sense, in that things can be shifted around so much. In some systems we'll have, for acupuncture, some systems will say, oh, the C points are for dredging the channels, clearing lots of stagnation out of the channels. It's this point that clears all of this stagnant water, or something like that. When through palpation or symptomology, or you gather that there's a lot of stagnation in the channel, you can clear that with C. Whereas some other ones, as we've discussed a little bit, water points pull water back into its respective organ. Now, this is quite different. I mean, this is, I'm not going to say opposite, but it's quite different, But that's what acupuncture allows for, is this kind of malleability. And the reason that this can work is because, in a sense, what you need to do is learn one system. And the self-consistency of that system makes it work the best. So if the C point is going to be dredging channels, you stick with that. They often say in acupuncture, sort of like, you don't get to, you can't go and study another system till you've mastered the system that you study. And it's not a respect thing for your teacher or something like that. I mean, it is, but it isn't. It's that each system, each family tradition that's been handed down, there's consistency within itself that makes it true. Okay? So this is a little bit different way of thinking, whereas sort of TCM herbology is generally widely agreed upon by most people. And it's a bit the finer points that we argue about that. But in general, Dangui does what Dangui does, right? Okay. So I urge you guys, if you're out here listening, the few of you that are out here listening, that you really find an acupuncture system and learn it. And what's cool is they're around. That's the beauty of kind of the renaissance of Chinese medicine that we're in right now. There are a number of resources. You want to learn Korean Sa'am style, there's I think it's Toby is out there teaching that. You can learn it. By the by, Sa'am acupuncture has the most comprehensive and refined system of constitutional psychology I think I've ever seen. So for those of you who are actually interested in psychology, rather than doing Worsley 5-element so-called classical thingies, go check out Sa'am acupuncture from Korea. It's quite amazing, quite advanced. You have Wang Juyi from, I think, mainland China, and that one's nice because they have a fairly robust community that you can learn from. I study the Akeda style in Japan, which is very elegant and quite nice. Not the strongest community to learn from, but still very elegant system, like the Wang Juyi. Also very elegant. You have the various Taiwanese systems, Master Dong, Dr. Tan, there's these kinds of things. There's Kiko from Japan. There are a number of systems that you can learn. And what's wild about it is how different these systems can be, so wildly variant from each other. Okay, anyways. So we talked last time about this, how heat, let's say deficiency heat in this case, transfers from the organ to the channels. Okay, so let me just give you two more examples of this, and then we'll call it. So maybe today will end up being a little shorter. So something like, let's say, related to the liver yin deficiency, you can also have kidney yin deficiency. And that kidney yin deficiency heat gets kicked out into the urinary bladder, which then gets kicked out to the urinary bladder channel. Right? So kidney yin deficiency organ symptoms, quote unquote, that you're used to sort of thinking about, things like insomnia, right? This is more when that deficiency heat's getting into the heart a bit. It rises upwards, so you get the night sweats, the heat, and the restlessness. But you can get more clearly defined kidney symptom like tiredness, fatigue, right? That heat can rise upwards into the ears, an area related to the kidneys, a place where you expect to look for kidney problems. So you get tinnitus. You can get forgetfulness, brain function as it relates to the kidney. Dizziness, also brain function as it relates to the kidneys. You can get sexual issues, vaginal dryness, reproductive issues like menopause, these kinds of things, right? With hot flashing and those kinds of symptoms, loss of reproductive function, indicating this kidney deficiency. And these are all kind of generalized sort of kidney areas. So reproductive area in the ears, sexual function, so these kinds of things. These would all be sort of generally considered organ, in a Chinese medicine sense, organ functions. Right, so then this heat, though, also gets kicked out to the urinary bladder, and you can get urinary issues, indicating bladder issues, right? So that heat can get stuck in the bladder. Things like chronic UTIs, frequent waking at night to pee, urgency, all of these kinds of things are possible, right? Well, what you often see, though, is that the urinary bladder organ is fairly well protected often, but you do see a lot of this heat getting kicked out to the channel. And the channel symptoms are things that you're actually used to seeing, but possibly not used to thinking about this way. Things like plantar fasciitis, right? A deficiency heat symptom, heat getting trapped in the urinary bladder channel around kidney 1, which is always so fun to treat. If your patient just won't put up with treatment on the bottom of the foot there around this, you could try to fudge it a little bit and do kidney 10 and kidney 2. That may be enough to draw that heat out of the bottom of the foot there, and then you don't have to go needling into the bottom of the foot. But I mean, there's a million treatments, and probably some of you are screaming and pulling out your hair and trying to tell me what your treatment is that's magical and doesn't hurt and works very well. So please, actually, if you have one, if you have anything, send that to me, and then I'll put it in the. I'll if it's a cool technique, I'll say it in the podcast here. So plantar issues. What else do you get? Knee pain. Knee pain, knee soreness, generalized knee soreness. It's not always just knee pain. Some people just have just kind of crummy knees, but it's not any specific area of pain. They're just kind of sore. When they sit on the floor or something, they can tend to get a little sore and locked up. This is this indication of this kidney yin deficiency heat. That heat is getting trapped in the knees. It's not the only cause of kidney-related knee pain, but it's certainly a common one, very common. And what happens is qi has a tendency to get blocked in joints. It's a very common place. It's a bend in the channel, so it's a common place for there to be stagnation. So, even in a sense, the bottom of the foot, certainly the knees. What comes next? The low back. Another bend in the channel, so to speak, and the low back is sore. From a strict channel perspective, this could be, or probably would be, considered deficiency heat in the urinary bladder getting trapped in the low back. Common, right? Stiffness of the spine, as it relates to fluid deficiency type stiffness. But from a strict acupuncture perspective, this could be more something like a heat kind of trapped in the channel there, mixed with this dryness, depending on how you think about it. You get neck pain, stiffness, right? Occipital headaches, common enough. Changes in the eyes, red eyes, dry eyes. Of course, we mentioned that with the liver, but also can be part of a channel pathology here. So there are many, 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 for those of you who do your system, you've got 10 to add. This is just a few, right? I'm not here to list off everything. Just an idea, right? That the heat then gets trapped in the channels. So here, of course, similar to liver 8 is the kidney 10. Kidney 10, liver 8, spleen 9. In the system that I study in, the C points are how you pull fluids back into the organs, right? Of course, they should be tender when you use them. You can use deep needling here. You can retain for a fair amount of time, trying to build up those fluids again. Okay, so this then sort of goes some distance to explain a set of symptoms, right? And then you can use points that might be tender on different parts of the channel in order to try and clear that heat through those areas, right? So like distal acupuncture. It'll help you to understand how you're doing local acupuncture, clearing heat and that kind of thing. My old teacher had a thing he would say, which was, if you're working in a particular area, localized pain area, and the pain is worse after the treatment, then there was a lot of heat. There was more heat in that channel than you realized, and it released that heat, but not in a way that was necessarily sort of circulatory. It just kind of released it right in that area, so they got more pain. So you got to do, then you do a knee treatment. There's more knee pain afterwards. Then you have to think about, how am I going to clear that heat more prophylactically in some sense. Kidney 10 then you start to think about distal urinary bladder points to help circulate that heat through, right? So these points that are famous for back pain, right? Okay, so this is one example. Another example being something like spleen deficiency. Now here with spleen deficiency, we don't tend to think about, spleen yin deficiency or something. That's not a normal way to think about it. Usually in this case, depending on, again, where you're studying, it could be more like spleen qi deficiency with stomach heat. And is that stomach heat coming from liver overacting, over a long period of time? Is that stomach heat coming from diet problems? Too much rich food, eating at the wrong times. You guys know the litany. So spleen deficiency leading to basically not leading to necessarily, I mean, it could be, but spleen deficiency and concomitant stomach heat at the same time. This would be one way to think about it. Right? Spleen qi deficiency, stomach heat, it's common enough, right? So then typical organ symptoms in this case, appetite issues, going in any direction, really, even sort of constipation issues, right? They say things like thirst, but indigestion, belching, nausea. They'll list things like afternoon fever, fever that kicks up in the afternoon. And so these kinds of symptoms, we typically associate these more kind of like organ symptoms in a sense. And you have to decide. I mean, spleen and stomach are kind of a unique organ among the five, right? So among the six. So a lot of systems don't make a differentiation between spleen and stomach in the way that we would differentiate between kidney and urinary bladder or something like that. It's often just spleen and stomach are sort of the same thing in some sense, right? So then here's this list of organ symptoms. But then you get this heat getting kicked out to the channel, right? So then you can get pain along the course of the channel. One of my old teachers was fond of talking about things like knee pain, especially when it was more like anterior knee pain. This could actually, it doesn't always have to be kidney deficiency. It could actually be stomach excess. So then you palpate along the stomach channel, along the lower leg, and if that musculature there is really tight, then that's the indication that the stomach channel has heat and stagnation in it, and that, and then from sort of an orthopedic perspective, the tightness of that muscle and this and that. So, right? Okay. So whichever way you're thinking about it, this stomach heat, this stagnation in the stomach, this heat stagnating in the stomach, it can stagnate also in the joints in the same way that we said the urinary bladder can. So then you palpate the stomach channel, the muscle's really tight. You can work on that to clear knee pain, especially anterior knee pain, right? You get things like frontal headaches. Right? This would be a really classic symptom related to spleen and stomach. Of course, it's very much related to the channel, right? Heat rising up through the channel. You get redness of the face, right? You can get ulcerations on the lips, ulcerations on the gums, recession of the gums, especially yin deficiency, but generalized recession of the gums due to ongoing heat. The teeth, toothache, dental caries. I had a patient come in and she was grinding her teeth at night and clenching her teeth during the day. But the distinction that she made that was interesting there was she said, I actually noticed that I'm clenching the front of my teeth rather than like grinding her molars. She was noticing that it was like her incisors that she was like sort of clenching and actually grinding her incisors, and enough that her dentist noticed it. And he was a little surprised. He's like, strange here, your molars actually look fine. It's your incisors are weirdly looking a little worn down. And so she was able to make that distinction. So rather than the normal thing that I would think about, it's like gallbladder heat and the grinding of the clenching and grinding of the molars. Here I thought to myself, stomach heat, more around the front, maybe. Well, sure enough, though, clearing that stomach heat did actually help her to stop that. So, getting into the teeth, into the gums, into the mouth, channel trajectory through the throat. Moving down, things like sort of like chronic low-level sore throats, chronic low-level swelling, right? I just recently had a patient who had fairly severe, acute, severe sort of discomfort in the tonsil area. And so much so that it was giving him anxiety attacks, right? Because it was quite uncomfortable, hard to swallow, felt like something was in there, right? We all know what we're thinking. Um, but what was interesting was right as it started, he doesn't normally have this. He got a geographic tongue right in the spleen stomach area. So suddenly there was like these peeled patches right in the center there, and that had kind of come out of nowhere, right? And so it was some kind of indication to me, deficiency heat or some kind of heat trapped in the stomach, getting into the stomach channel, getting into then the throat and getting stuck there. And what was interesting about that was there was a plump sensation, and there was this history. He had a choking incident when he was a kid, and really clenched that area. And when I started asking about it, he was like, "That's a bizarre question, because I, since the age of 6, have always had sore neck. My voice gets really tired easily, but it's always kind of tight and sore." And he's like, "I've just always noticed this." But he's never really had a problem until this heat suddenly came out. Well, we did some treatment, and it was an interesting results, mixed results a bit. But what was interesting about it was that ultimately, he woke up one morning and the throat thing was completely resolved, the anxiety was completely gone, and his tongue was completely back to normal. He had never really seen geographic tongue before that, and all of a sudden it came, and then all of a sudden it just went away. I'd love to say that it was my treatment, but it's not totally clear to me that this is the case. Actually, what I did do was I gave, because of the fair strength of this plum pit sensation, I gave Bancho Hopotang with some emollient, a little bit of dangui, a little bit of maimendang, just to kind of lubricate the area, not overly dry. And he was taking the Bancho Hopotang, but it was difficult for him because he said that it created an uncomfortable sensation in the throat, and it was making his anxiety go up. And I wasn't sure what to think about that. Was it that the Hopo and the Zutsuye had this regulating effect on the throat, increasing blood flow into that area, and an area that he had locked down basically his entire life due to fear from this choking incident as a kid? Then the movement was so novel for him. The regulation of qi in that area and the movement of the musculature, maybe a change in how his muscle, just a simple relaxation of some of the muscles in the area, maybe he was registering that as uncomfortable, and it was causing him to kind of lock up more. Either way, he was a little mixed on taking the formula, but what was interesting was he was taking a very low dose. He was perceiving that as making him feel worse. And again, I'm not sure exactly what's happening here. But the uncomfortable sort of sensation that was initially the cause of his anxiety and stuff, that was going away, even as the rest of his throat was like sort of felt like it was swelling more, felt like it was clenching more maybe, and yet the core symptom had gone away. So again, I don't know what to make of that. I suspect that it was a more mental response to the movement of qi in an area that he had locked down for a long time. But again, not totally clear to me. And then one morning he just wakes up and it's totally gone. And, I don't know, maybe. So anyways, this heat getting trapped in the throat, right? Swelling of the throat, or a chronic sore throat. We talk about chronic sore throat as a yin deficiency symptom coming from various areas, but it could be the stomach, spleen-stomach complex. You get eye pain, eye issues. Big one here is conjunctivitis, right? So sort of heat and damp affecting the conjunctiva, the mucus tissue. They call it mucus, the tissue of the eyes there, of the eyelids, the inner tissue of the eyelids there. Redness, these kinds of things. What else do you get? Oh, nosebleeds. I see this in kids relatively commonly, kids with chronic nosebleeds. It can be lung heat, sort of a sequela to some kind of lung heat event like a pneumonia or something like that. And then in the aftermath, they have this lung yin deficiency. And then, of course, the nose sort of being the flower of the lungs, it's a common place for that to show up. but it could be a channel problem related to stomach heat. So if the kid comes in and they're having chronic nosebleeds and I'm just not seeing any lung history, then I may have to go to stomach history. How's appetite? How's bowel movements? Sour smells and these kinds of things to try to suss out if there's any heat, right? Maybe in this case, there could be anxiety, sort of stomach heat getting into the heart. I had a teacher who said that the heart sits upon the stomach, sort of like an apple on a plate or something like that. So heat in the stomach easily gets into the heart. It's common for us to say, oh, heat from the stomach can go into the liver. Back and forth, goes in two directions. All right, so heat from the liver getting into the stomach, but enduring heat in the stomach can actually get into the liver, right? So this kind of thing, then, so this heat in the stomach channel gets into the nose, leading to frequent nosebleeds. Okay, so this then is just a way of reviewing or giving another example of what constitutes organ pathology versus channel pathology. Okay? All right. That's it for now. You guys keep reaching out to me if you have topics you want to hear. I've heard from a couple of you, but if you got something you want to hear or you want to be interviewed, you're interesting in some fashion, you guys have been sending me some emails, so send me emails. Let me know you're out there. Let me know what you want to talk about, and I will endeavor to complete that mission. Okay, guys, take it easy. Huh?